In this video, we'll conclude our series on cortical remapping treatments for patients with persistent low back pain. We'll discuss expected treatment effects based on current evidence, directions of future research, and final recommendations for use. Much of the research for cortical remapping interventions has centered around persistent pain syndromes such as phantom limb pain and chronic regional pain syndrome. But we need to be very cautious when generalizing these results for patients with persistent low back pain. A small systematic review by Dafida et al. In 2014 examined the effect of various cortical remapping interventions on persistent low back pain. However, the interventions studied were fairly heterogeneous. 2 randomized control trials looked at sensory discrimination training. 1 randomized control trial looked at motor control exercise. 1 randomized crossover study looked at enhanced multisensory feedback. And 1 multiple case study looked at a combination approach. The authors concluded that cortical remapping interventions might have potential for persistent low back pain, but that much more evidence was needed. In 2016, a small systematic review by Kalin et al. Examined sensory discrimination training in particular for patients with persistent low back pain. Evidence was positive for improvements in pain and function, but with very small clinical effects, perhaps too small to be clinically meaningful. Additionally, performance varied against control groups, with some studies showing non-significant results compared to control groups, and 1 study showing inferior performance when compared with the control intervention. In a recent review published in 2019, Malfliet et al. Argued that sensory discrimination training should not be considered for patients with persistent low back pain due to the low quality of evidence and conflicting results. As far as I know, the effects of graded motor imagery on persistent low back pain have not been studied in a significant way, though there is limited research that shows that graded motor imagery may be effective for the treatment of other persistent musculoskeletal pain syndromes. In a 2017 review, Mosley argued that the small treatment effects of cortical remapping interventions for persistent low back pain might be attributed to the fact that most studies have only looked at 1 cortical remapping intervention at a time. For example, a study might investigate sensory discrimination training, or graded motor imagery, or motor control exercise. But these interventions are rarely combined in an integrated and progressive way. If patients with persistent low back pain have cortical changes across multiple sensory motor domains, it might make sense then to target multiple body representations in treatment. To this end, there is a large RCT, the RESOLVE trial, underway that is investigating a multimodal and progressive cortical remapping intervention combined with pain neuroscience education for patients with persistent low back pain. Instead of just using 1 type of cortical remapping treatment, clinicians will treat patients with a combination of graded sensory training, graded motor imagery, and graded precision focus and feedback-enriched functional movement training. This will all be occurring in the context of regular discussion of the low back pain experience and how that fits in with principles of pain neuroscience education. The hypothesis is that combining these interventions in a meaningful way will yield a much greater treatment effect than any 1 treatment alone. But results are still pending, so stay tuned. Considering current evidence, it seems that cortical remapping interventions such as sensory discrimination training and graded motor imagery should not be the first choice for treatment for patients with persistent low back pain. However, for patients unable or unwilling to consider movement-based therapies due to high pain levels or fear avoidance belief patterns, these cortical remapping interventions might be considered. They might also be considered for patients who are failing to make progress with movement-based treatment. When using cortical remapping interventions as part of a treatment strategy for patients with persistent low back pain, there are some things to keep in mind. First, these interventions should be used within a biopsychosocial framework. In particular, these treatments align well with the pain neuroscience education approach, as they offer ample opportunity for discussing and reshaping a patient's understanding of pain. In addition, lifestyle modification seems to be very important for patients with persistent low back pain, and screening for and addressing sleep quality may be of particular importance for this patient population. Finally, effort should always be made to progress in a structured and steady way towards movement-based interventions. Lingering at the premotor stage during treatment is unlikely to drive significant recovery. But using cortical remapping treatments as a temporary stepping stone to movement-based therapy might be useful.